So here's what we're going to do. First of all, we want to train new young people because the field has to be full of people to do all the things that need to be done. Thank you, Kevin, and thank you, Craig, and thank you, Annemiek. I think Annemiek showing us the basics and Craig showing us the AdCom was an amazing experience for all of us and how advocacy matters. And then for Kevin to show us that it's not just microdystrophin, there's lots of ways to think about treatment. So we're worried about the 4 to 5s at this moment, but there's a lot of people that we need to do therapies on, and there are lots of possibilities. So I'm going to ask Craig to come up, but right now we're going to do PPMD's advocacy with Lauren and Niki, and then we'll take some questions before we break. So if that's okay with you, Niki and Lauren, please come up, and Craig, have a seat, and then we'll do all of your questions. And you can go on the break, and those of you who have questions can stay, and we'll talk. All right.
Hi, everyone. I'm glad that they're doing questions after, so now you're forced to stay for Niki and I's presentation. I'm Lauren Stanford. I am the Director of Advocacy at PPMD. I've seen a lot of familiar faces here from the Advocacy Conference. It's great to see all of you guys, but I'm just going to give you a little spiel on why advocacy matters and how you can share your voice, and then I'm going to pass it over to Niki. This button thing. Ooh, let's see if I can get the slides to go. Oh. Okay, so just a little bit of history, which this might be. Oh, I stole some of Ryan's slides, and I think some of them have transitions in them. So when PPMD first started in 1994, there were a lot of questions that were being asked, and there were things and missing pieces that we realized we really needed to address. I'm sorry, I can't get the slides to work. Oh, there it goes. And then we identified the critical missing pieces, and the easiest way we thought was, or Pat and her team back then thought, was to address this was through advocacy. And since then, there's been a lot of progress made. Oops. Sorry. Oh my God. Okay, so it's not me. It's other people back here are saying it's not me, it's the slides. So since then, we've made a ton of progress. The MD CARE Act was passed in 2001, and since then, we've been able to get over $800 million in federal funding, and then we've passed a lot of other bills that have been really important to our community to help improve our community and make things better for all the folks who are living with Duchenne and Becker and other muscular dystrophies. And then, if I can get my slide. Okay, so yep, those are the different numbers to the CDC, NIH, and the CDMRP, which is the DoD research funding program. But none of this would have happened without advocates like you guys and your family sharing your stories. And this money is vital to research in Duchenne muscular dystrophy. And we really wouldn't have had any of these things without advocates like you guys sharing your stories and being so willing to share your story with members of Congress and state legislators and all of that. So it's really important that we continue advocating because there is still so much more work to be done to improve the lives of folks living with Duchenne muscular dystrophy and other muscular dystrophies. And the thing I love about advocacy is there's no too small a way to share your story. If you're interested in coming to DC in March for our Advocacy Day, there's a photo up there of some of our advocates on Capitol Hill this year. We love having folks there. We love having you in Capitol Hill sharing your story and helping get like those research dollars funded through the federal government. But then also you can do anything as simple as just sending in an action alert when we email you and say, hey, we need you to contact your member of Congress. And then I'm so glad the AdCom was talked about earlier because we did a lot of advocacy and got people to share their stories through that. And that was a really important form of advocating. And I know some of the families who shared their stories are here too. And there's no bit too big or too small way to involve yourself in advocacy. And I really like it because you can kind of pick how involved you want to be, and there's never too little, and anything you do is helpful, and we need all the voices we can get to keep making change. And with that, I will say, let's see if I can get this to work. So if you're interested in becoming an advocate, you of course can come talk to me about it. I'm going to be around here this whole week, of course, and I'd love to talk to anyone about how they want to be involved. But also on our website, under the advocacy tab, you can sign up where it says join PPMD's Action Network, and you can sign up and you'll get the email blasts we send out when they say share your story or contact your legislator, or we're doing an AdCom and you should submit your comments to the FDA. So that's really how we communicate with our advocates. So definitely sign up there, but then I'm also on the next slide, my email is going to be there, and I would love to hear from you guys if you're interested in getting more involved on a deeper level. And Niki's going to talk about some of the work we're doing in states. And one of the things we're really working on right now is building up our newborn screening program, and that takes a lot of state advocacy. And we want to do Medicaid reimbursement work, and that's, again, state advocacy. And we really need you guys to help share your stories and get some of the things moving there. But I'm going to... That's my email. Seriously, please email me. I love to hear from you guys. I love to chat with you all. But I'm going to pass it over to Niki, and she's going to talk some more about some of the projects we are doing. Good luck with that.
Like I said, my name is Niki Armstrong. I am one of the genetic counselors here at PPMD and the Associate Vice President of Community Research and Genetic Services. And I'm going to focus on some more specific ways that you can take action and be involved with PPMD. So newborn screening is one of my passions, one of the things that I spend most of my time at PPMD on. For those of you who aren't familiar, pretty much every baby born in the United States gets newborn screening between 24 to 48 hours of age. And the purpose of newborn screening is to identify conditions where when we intervene early, the baby has benefit from that intervention. And PPMD has long believed that newborn screening is needed for Duchenne. And I have some of the key reasons listed up here. One, we know that muscle damage starts early, and optimal treatment probably needs to be earlier than when we are typically diagnosing kids. I think some of Dr. Flanagan's data today showed that. We also know that most families face a diagnostic odyssey, a time where they're concerned, they've noticed some potential issues with their child, but they don't have a diagnosis. On an average, that's about 2 years of families worrying without an answer. And lastly, we know current diagnosis is not equitable. And what I mean by that is that the color of your skin, where you live, whether you have a diagnosis of autism, all of those things affect when you get diagnosed. And that's not fair. We want every child to have the same opportunities, and newborn screening is a way to make sure every child gets diagnosed early. So newborn screening in the United States is a state-based program. And what that means is that every state gets to decide what conditions are on the newborn screening panel. Most states screen for between 35 to 50 conditions. This map here is showing states in the darker colors screen for more conditions, states with lighter colors screen for fewer conditions. And every state gets to decide what conditions to add to screen for. So as new treatments become available, new conditions have to be added to newborn screening, but it's a state-by-state process. So how do we get to newborn screening for Duchenne? Well, one big piece that PPMD has been working on for multiple years, and maybe you've seen the blogs and the posts about it, is trying to get Duchenne added to what we call the RUSP. And the RUSP is the Recommended Uniform Screening Panel. So while newborn screening is state-based, the federal government makes a list of conditions that they recommend every state screen for. And that's the RUSP. It is just a recommendation, it's not a mandate, but it holds a lot of weight. It's like a stamp of approval saying that you should really screen for this. And there are some states that have laws in place where if it's on the RUSP, the state will automatically screen for it. In order to be on the RUSP, a condition has to be nominated and then go through a very long and thorough review process. And that review is done by a federally appointed committee called the Advisory Committee on Heritable Disorders in Newborns and Children. And that committee is made up of experts in newborn screening, data, and ethics. So this is a detailed slide, and don't worry about that too much. It's really just here to show that the process of getting on the RUSP is really long and has a lot of steps to it. Like the fastest a condition could go through this RUSP review is about 18 months, but most conditions take more than 2 years. We initially submitted back in June of 2022. If any of you have been following along, in February there was an initial vote and the committee voted no to not move on in the review process, but then soon after asked us to resubmit as soon as possible, which we did at the end of May. And we're now hopeful to be at the next vote in the review process in August. If everything proceeds very smoothly from here, we would actually be added to the RUSP probably late next summer or early next fall. So really long process. So a question I get a lot is, okay, well, is anyone doing Duchenne newborn screening? There aren't any states that are screening every newborn. There are some programs that are ongoing. In North Carolina, there's a research study that families can participate in for newborn screening for Duchenne. And there's also a small hospital-based program in Boston through Brigham and Women's Children's. There are also multiple states that are considering Duchenne already, even though that we're not on the RUSP yet. So there are state advisory panels that tell the state what they should screen for. And both Minnesota and Massachusetts are reviewing Duchenne right now. And then there's state legislation in place that is currently moving along in both New York and Ohio. So what can you do? Like Lauren said, we really need families willing to share their stories, both at the federal level with the RUSP process and at the state level, because eventually we're going to have to go to pretty much all 50 states in order to get newborn screening. We also need families who are willing to reach out to their state representatives. So if this is something you feel passionate about, please reach out to me or reach out to Lauren, and we will get you in our pool of people to help us move these efforts forward. Okay, now I'm going to switch gears and talk about the other big thing I do at PPMD, and that's the Duchenne registry. So hopefully you're all familiar with the registry. It is an international self-report registry for people who have Duchenne or Becker or are carriers. It is a great thing, and hopefully you're already participating, but if you're not participating, there are really some key reasons to think about it. With Duchenne, sometimes it can feel like you don't have a lot of control or there's not much you can do, but actually providing data through the Duchenne registry, and you do that by filling out surveys in an app, is a great way to advance research. That data is used by scientists throughout the world, actually, and we also use it for things like lobbying and insurance companies. It has lots of uses, so it's really important. You can also have benefit from it because many companies who make drugs contact us about recruiting for their clinical trials. Oops. Well, never mind. Well, that's fine. Many companies, they contact us about their clinical trials with the enrollment criteria, and we can search the database. If you fit those enrollment criteria, then we send you an email. Your information stays private within the registry. Thank you. But you get the information about the ongoing clinical trial, so that's super helpful. And then the last reason is every single person with Duchenne or Becker or who is a carrier is different, unique, and really to get the best and most complete understanding of the conditions, we need to have as many people as possible. So everybody sharing their information will give us the most complete picture. The registry is, like I said, pretty amazing. We have more than 5,500 people in it, more than 100 countries, more than 15 years of data, and it's been used for clinical trial and study recruitment on more than 100 studies and trials. And one thing I wanted to let you all know is that we are working on our 15-year report. So essentially, we took the data going back to the very beginning, and the data analysis of that is complete, and we should be able to start releasing pieces of that later this summer, so we're really excited about some of the things we learned through that process. We also wanted to let everyone know that the app is now available in Spanish, which is amazing. The questions and the responses are all in Spanish, and so we hope to get the word out to all of our Spanish-speaking families so that they can participate as well. And then the one last piece that's sort of new in the registry that I wanted to bring up is a partnership that we have going on with some of our certified Duchenne care centers. So that map there on the right that is not showing up well is showing sites where we are partnering with CDCCs in order to bring over electronic health records. So it's color-coded with the Arkansas Children's in the red being the kind of site furthest along. But essentially what happens is if you are at one of those sites, you would be asked to consent. And if you provided consent, certain portions of your medical records would flow into the same database where the Duchenne registry lives. And then that data can be matched together. The Duchenne registry is asking families for their experiences, but there is some information that actually is really useful to get from the medical records themselves, and that combination of those two pieces should give us the most complete picture. And then eventually we'll be able to ask fewer questions in the registry, which will make it easier for families to participate. So it's a win-win, and we're really excited to move forward with this. If you have any questions about the registry, the genetic counselors are all here at the meeting. You can reach us through the CVent app. You can schedule one-on-ones with us, or you can email us, call us. And one last plug, we will be at the resource fair tonight, and we have Starbucks gift cards, 50 of them for the first 50 folks who come to our booth. So we hope that you will all stop by and say hi. And that is it for me.
Thank you, Niki.